Hello, I'm Secretary of Labor Lynn Martin. I'm here to introduce the Occupational Safety and Health Administration Standard on Bloodborne Pathogens. The standard, which is effective as of March 6, 1992, is a pioneering step by the Department of Labor to protect all of us from bloodborne pathogens, such as the HIV virus and the Hepatitis B virus. It covers an estimated 5.6 million workers, most in the healthcare industry, but others in businesses such as research laboratories, law enforcement departments, funeral homes, and fire and rescue operations. It is vital that we protect America's working men and women from the risks of bloodborne pathogens. The following presentation explains the new standard, tells how it will affect you, and how it will help you do your job while dealing with these hazards.
Albert Camus, a French novelist and Nobel Prize winner, used the plague as a metaphor. He explored how ordinary people act in times of uncertainty and risk. The most moving and most heroic parts of the story were about the healthcare workers and their professional responsibility. We need professional responsibility because very real and very deadly diseases have crashed down on our heads. According to the Centers for Disease Control, AIDS has already killed over 100,000 Americans. It's estimated that well over 1 million more are infected with the virus that causes AIDS. And the center's estimates on hepatitis B are very sobering. Each year, about 8,700 healthcare workers are infected with hepatitis B. And each year, about 200 of them die from it. Hepatitis B and AIDS are called bloodborne diseases because the organisms that cause them are carried in blood. Bloodborne pathogens pose a special threat to healthcare workers and to other people who come in contact with blood and certain body fluids while doing their jobs. This program explains vital precautions you must use in the workplace to protect yourself. The precautions are targeted against all bloodborne pathogens. And there are several diseases that can be transmitted in blood and other potentially infectious materials, but two are especially dangerous: hepatitis B and AIDS. Hepatitis B affects the liver. It is a very serious disease and is the greatest infectious bloodborne hazard for healthcare workers. For some, hepatitis B often causes chronic, lifelong medical problems. In the worst case, the disease is fatal, and there is no cure. But there is a safe, effective vaccine against hepatitis B. Your employer is required to provide it at no cost to you. All occupationally exposed workers should be vaccinated. Defend yourself from hepatitis B and avoid pain and illness. But there is no vaccine and there is no cure for the acquired immune deficiency syndrome. AIDS always kills. Both diseases are caused by tiny organisms called viruses. The virus that causes hepatitis B is called HBV. Even the tiniest traces of blood can be contaminated. 1 milliliter of blood may contain 100 million infectious doses of the hepatitis B virus. The virus that causes AIDS is called the human immunodeficiency virus, or HIV. It's important to understand the distinction between the HIV virus and the disease AIDS. If a person is infected with HIV, medical tests will show that the person is HIV positive. That means that the person has antibodies to the HIV. It does not necessarily mean that the person has AIDS. A person who is HIV positive can feel completely normal, but sooner or later the HIV infection develops into the disease AIDS, and AIDS is a fatal illness. Essentially, HBV and HIV are transmitted the same way. Now let's look at the routes these blood-borne pathogens can travel to enter a person's body. The blood-borne pathogens are transmitted in human blood and other potentially infectious materials such as semen, vaginal secretions, and saliva in dental procedures. These blood-borne pathogens have not been shown to be transmitted by sweat, tears, urine, or feces. But remember, these substances can also be mixed with blood. For healthcare workers, the most common risk of exposure is by needle stick injury. Exposure can also happen when blood or other potentially infectious materials touch the eyes, nose, or mouth. Finally, exposure can occur if contaminated blood or other potentially infectious materials come in contact with dermatitis, open sores, or nicks and cuts on the skin. Blood-borne pathogens pose very real, life-threatening dangers, but there is no reason for panic. Consider this fact about AIDS. In the last decade, hundreds of thousands of healthcare workers have helped millions and millions of patients. Yet in 10 years, there are only about 65 reported cases of HIV infection related to occupational exposure. But the number of unknown cases in the general population is very sobering. For each patient actually diagnosed as HIV positive, there may be 40 undiagnosed people walking around. We do not know which individuals may have the virus. Because of the uncertainty, you must treat all blood or other potentially infectious materials as if it were infectious. We call this taking universal precautions. And universal precautions must become a part of how you do your job. For your own safety, treat all blood as if it contained blood-borne pathogens. Federal regulations have been issued by OSHA, the Occupational Safety and Health Administration. The regulations cover anyone who has reasonably anticipated skin, eye, mucous membrane, or parenteral contact with blood or other potentially infectious materials resulting from the performance of his or her duties. If your work brings you in contact with blood or other potentially infectious materials, you're covered by the Blood-Borne Pathogen Standard, which is Title 29 of the Code of Federal Regulations, Part 1910.1030. It contains complete and comprehensive rules requiring such things as exposure control plans, free hepatitis B vaccinations for workers with occupational exposure, rules for training and record keeping, special rules for research laboratories, and appropriate medical follow-up after an exposure incident. That's very important. If you do have an exposure incident, report it promptly